Thank you for joining me to learn more about mindfulness, research, and best practices. I'm Kimberlee Bethany Bonura. You can learn more about me and my work on the web at drkimberleebonura.com, chairyoga.com, and pelvicyoga.com. You can find me on Facebook at Dr. Kimberlee Bonura and on Twitter at Dr. K. Bonura Yoga. If you want to stay updated for when I post new videos, then like this video and subscribe to my channel. By continuing with the video, you, the viewer, are agreeing to and accepting the terms of the provided waiver of liability. Hello and welcome back. In this lesson, we'll be discussing best practices for the use of mindfulness strategies with older adults. In this lesson, we'll discuss first, how to identify qualified mindfulness practitioners for referrals and collaborations. Second, potential contraindications for mindfulness practice of which you should be aware. And third, strategies for how you can integrate mindfulness-based strategies into your practice and care plan with older adult clients. Let's get started. You may be considering your options for referring older adult clients to mindfulness practice as an adjunct to care and as a useful self-care strategy. Before you begin making referrals, develop your own competency and familiarity. In our journey together in this course, you've gained some brief exposure and hopefully some insight, and I encourage you to keep learning. Look for programs in your local area so that you can develop additional understanding of the various mindfulness-based modalities. This allows you to further your experience with mindfulness and also offers you the opportunity for first-hand experience with the instructors in your area. You will want to establish relationships with qualified instructors in your area. It is important to identify instructors who are trained and certified or registered within their domain. In the additional resources area of this course, part of Module 4, I list a variety of organizations that you may find helpful in locating instructors in your area. Institutions in your area can also be helpful for finding qualified instructors. For instance, many hospitals and medical centers now offer classes or workshops on the use of mindfulness-based care in healthcare settings or for individuals with chronic conditions. For instance, some cancer care facilities include yoga and meditation classes in their programming as a way to support both patients and family caregivers in managing stress. Some universities may offer mindfulness-based lecture series or workshops. Also, community centers and university-based senior learning programs may have classes. These are all venues in your local area where you may be able to find mindfulness instructors with experience in working with older adults and/or individuals with chronic conditions. When you're considering an individual instructor, you'll want to make sure they have CPR certification and that they are trained in working with older adults. For instance, they should have some familiarity and training with older adult fitness. The Physical Activity Guidelines for Americans from the U.S. Department of Health and Human Services is a great place to start, especially the chapters on active older adults and additional considerations for some adults, which addresses fitness when dealing with chronic health conditions. I've included a link to this resource in the Additional Resources section in Module 4. You should also continue learning about the empirical benefits of mindfulness. Look for scholarly articles in academic journals which provide more insight about the benefits, contraindications, and safe practice of mindfulness-based strategies with older adults. Once you feel comfortable in your knowledge of mindfulness to consider referring clients, you will want to consider how you discuss this with your clients. First, remember to discuss mindfulness-based strategies and other forms of complementary and alternative medicine in an open dialogue with your clients. Allow them to share with you what CAM modalities they may already use. Providing an open, safe, and non-judgmental space will support your clients in feeling comfortable discussing with you what they are already doing, so that you can provide supportive guidance and strategies for safe use. If you have clients for whom you think mindfulness-based practices will be supportive, consider recommending mindfulness as a form of self-care. You can discuss the ways that mindfulness-based practices, such as yoga and Tai Chi, can be gentle forms of exercise and great for stress management. You will also want to discuss multiple modalities, since not all forms of mindfulness feel comfortable to all people. This is why it's helpful for you to identify a variety of instructors in your area. Some clients may enjoy yoga, others may prefer Tai Chi, and others may prefer a mindfulness-based stress reduction taught in a hospital and framed within a medical model. Some may enjoy the environment of a local yoga studio, and others may prefer a class at the community center. Some individuals may wonder if mindfulness-based practices are appropriate for them. For instance, devout Christians may not be comfortable in a yoga setting with Sanskrit language and chanting. Remember that different teachers, different settings, and different models work for different clients. So frame the conversation within the needs and interests of that individual so you can make the best referral. Now I'd like to move to a discussion of potential contraindications. While mindfulness-based practices are often gentle and inclusive, not all mindfulness-based practices are gentle and inclusive, and it's important to be aware of potential contraindications. First and foremost, when you are referring older adult clients to mindfulness-based practice, you want to make referrals to programs that focus on well-being. You do not want to send your clients to mindfulness instructors who focus on perfect or strain. From personal experience, my own motivation for yoga teacher training occurred after my mother, then in her 50s, had to have knee surgery after a yoga teacher forcibly pushed her into a more perfect yoga posture, and she tore a ligament in her knee. There are some yoga classes and martial arts-based classes that are very strenuous and which focus on achieving the perfect physical pose, on pushing through even when it hurts, as a form of mental discipline and control. And these are not the right settings for your referrals. You want to identify instructors who focus on the internal work of mindfulness, on the mental awareness and breath-based control, and who encourage individual and personal acceptance. In terms of specific contraindications, there are several things of which you should be aware. Hot yoga, which is yoga done in a heated room, is contraindicated for anyone with a risk of overheating, especially individuals with heart disease or cardiovascular conditions. Movements that create stress on the joints, for instance, jumping or fast pace between postures, is inappropriate for individuals with joint issues, with arthritis, or with osteoporosis or osteopenia because of the risk of injury. Fast movements are also inappropriate for individuals with vertigo or inner ear issues, Parkinson's, and other conditions that affect the balance. Some yoga classes include inversions where the individual goes upside down, such as headstands or shoulder stands, and these are inappropriate for individuals with ocular issues such as glaucoma because of the increased ocular pressure when upside down. Some inversions are actually weight-bearing, with weight on the upper body or neck, and these are not appropriate for individuals with osteoporosis, arthritis, or other issues related to the bones and the joints. Pranayama, which are breath-controlled practices, may not be appropriate for individuals with certain anxiety disorders or a history of panic attacks or bipolar disorder because of the way the breathing patterns can affect energy, arousal, and mood. Make sure if you have a client with these conditions that you are referring to a mindfulness instructor with experience with anxiety and arousal. While it's unlikely that you'll be incorporating any of these particular forms of mindfulness into your clinical practice, it's good for you to be aware of these medical contraindications and to discuss as needed with your clients. And so, when you're making referrals and considering mindfulness-based modalities for your clients, generally, it will be appropriate for you to refer your older adult clients to Hatha yoga, to chair yoga, to Iyengar yoga, restorative yoga, and Vini yoga, to mindfulness-based stress reduction medical interventions, to meditation training, to Qigong and Tai Chi. You may consider referring older adults to more strenuous forms of yoga, such as Kundalini or Vinyasa or Power or Ashtanga yoga, if the individual is very fit, has no chronic illnesses, and has medical clearance from their physician. The same is true for martial arts modalities other than Tai Chi and Qigong. They may be appropriate for very fit older adults. However, the individual should discuss this with their physician and should discuss with any potential instructors whether the program includes physical contact with others, such as sparring practice. Generally, hot yoga will not be appropriate for most older adults, and I would recommend avoiding referrals to programs that include heat due to the potential health contraindications. You may want to actually incorporate mindfulness-based practices into your work as a therapist, especially as you gain familiarity and experience. Berman and Tebb suggest that you consider mindfulness-based strategies as a way to support psychotherapy, medication, and other medical models of intervention. As we've discussed, you can do this by first discussing with your clients. What do they already do for self-care? This allows them to share with you any mindfulness-based practices which they may already practice and opens the door to further conversation. You can then suggest mindfulness-based movement such as yoga and Tai Chi as a way to support exercise and stress management. For individuals who are inactive or minimally active, yoga and Tai Chi offer gentle exercise which is accessible to most individuals. Since we know the psychological benefits of exercise and the effects of exercise in reducing stress and depression and anxiety, this can be a great way to support your in-session work with clients. Make sure as you make referrals that you provide basic guidelines about the benefits of mindfulness practice and the contraindications we have discussed. This supports your clients in making safe decisions that support their particular health conditions and individual needs. Overall, your goal is to empower your patients with information that will allow them to make good decisions about physical activity and self-care. Within your practice, you can further support mindfulness with your clients. For instance, you may want to try starting and ending sessions with a brief breathing or meditation activity. This can help your clients to focus, to become present in the moment, and therefore help them to really make the best use of the therapeutic space. Breathing deliberately may help the individual to be more present in their emotional experience, with less physical guardedness, and you may find that your patients open up more easily and more rapidly when starting with a breath or meditation exercise. It is common, especially for individuals with a lot of personal guardedness, that sometimes breathing and meditation, particularly if you include some posture and chest opening work, may lead to tearful outbursts. Crying can be very common in yoga and meditation classes, as the individual feels the physical layers of stress release from the chest, creating a sense of physically opening the heart area. Encourage the individual to just experience their feelings, to let the tears flow, to just be present in that grief and release. And then when they are ready, you can move into your counseling and therapeutic work. As a homework exercise, you could assign your clients to try a simple daily mindfulness practice. For instance, in the model I've outlined here, you can encourage clients to pick 2 daily activities, something like hair washing or dishwashing, something they do every day, and to purposefully breathe and be aware in the moment of what they are doing when they do it. The point is to let go of multitasking and to highlight the potential for mindfulness and breath awareness within daily life, rather than as something extra. Ask your client to do these activities every day for a set period of time, for instance, for 2 weeks, and then discuss how they feel and if it's made any difference in other areas. One research study found that mindful dishwashing led to reduced stress, and so this is a helpful strategy to notice how mindfulness in small ways can yield big impacts. I hope this has been helpful information, which will support you in integrating mindfulness practices into your therapeutic work with older adult clients. If you have questions, please let me know, either via the class discussion board or after the class has ended. You are always welcome to email me at learn@drkimberleebonura.com. You can find me on the internet at www.drkimberleebonura.com. Thank you for joining me in this lesson. Have a great day. Thank you for joining me to learn more about mindfulness research and best practices. If you like my content, please subscribe to my channel to stay updated for new videos. I'll see you next time.